I'm not going to lie, it's tough. My COVID long haul patients have it tough. I see them struggling, many of them day in and day out. Whether it's shortness of breath or fatigue or cough or brain fog, memory issues, depression, anxiety, muscle aches, palpitations, feeling dizzy or lightheaded, simply not being able to do the things they used to be able to do, it's tough. And yes, there's a range for people who are COVID long haulers. Not everybody has the same symptoms and to the same degree, but it is tough. And we know that depending on which study you read, there can be anywhere from 10 to 30% of people who get COVID who end up as COVID long haulers. Kids can be included in this too. Guys, this is a really big deal. Today we are talking about treatment options for those who are COVID long haulers. This is so important. Remember, the CDC's definition of a COVID long hauler, in case you're wondering, is a person who has new, returning, or ongoing symptoms 4 or more weeks after being infected with COVID. And they can be any of the symptoms I mentioned to you at the beginning of this video, and it can be so much more as well. I mean, honestly, the range of symptoms is so vast. It's one of the reasons why this is such a tough thing. And honestly, there are more questions than we have answers in terms of long haulers and long COVID. Why, where, what, when, how, all that stuff. There's a lot we just don't know. But there are some things you can do. I first want to remind you that long COVID can actually be classified as a disability under Titles 2 and 3 of the American Disabilities Act and Section 504 of the Rehabilitation Act of 1973 and Section 1557 of the Patient Protection Affordable Care Act. It's not to say that all people with COVID long haul or long haul COVID will qualify as having a disability, but some may. This may afford you protections, workplace modifications at your workplace, also protection from disability-based discrimination and other benefits. So just keep this in mind. I'm not a disability specialist, but as a doctor, I do believe it's important to remind you that you may qualify for having a disability if you have long COVID, depending on what your symptoms are and what you're going through. Now, what do I recommend for my patients? Well, I recommend multidisciplinary care. What does that mean? That means sort of a whole person approach, meaning we deal with the whole person and everything. I want multiple specialists involved because generally, and with my patients, many of them have multiple symptoms from shortness of breath, brain fog, anxiety, palpitations, etc. This often means I may need to get pulmonary involved, cardiology involved, physical therapy involved, psychotherapy perhaps involved, and other people as well. So keep that in mind, that I do really believe that multidisciplinary approaches can be very helpful here because often these things may feel and may be actually interrelated and intertwined. They may affect one another, your symptoms. The other thing I would recommend is, actually I've recently gotten a couple of brochures from physical therapy places near where I practice in New Jersey that advertise sort of comprehensive care for long COVID sufferers, meaning physical therapy places that offer pulmonary rehab. So breathing exercises if you're having trouble with fatigue and shortness of breath and cough and things like that. Also occupational therapy, physical therapy, and other types of therapy as well. And then I would also say the last thing I think is really helpful is you should Google long COVID centers, long COVID research centers, long COVID centers. These are at, and what I recommend are the ones at major universities and at medical centers where they have board certified physicians that often are doing research, but provide sort of a comprehensive one-stop shop environment for you to be treated by a multitude of specialties and to be cared for comprehensively, because I do think that's important here. I want to caution you that there are a lot of sham treatments out in the market right now. There are scammers everywhere, and there have been scammers that have scammed us with COVID tests and even COVID vaccine cards and so much more. There are also sham treatments that are being marketed as treatments for long COVID. I tell you, and I'm telling you this, before you take anything, try anything, sign up for anything, make sure you talk to your doctor. It's okay to do your research and check up on sort of these board certified, university center or medical center long COVID centers. I just said center, the word center a lot of times, but you get what I'm trying to say, or physical therapy centers or what have you, but make sure you talk to your doctor. And remember, the symptoms you might be experiencing, yes, might be due to COVID, but they also could be due to something else. So you don't want to assume that they're due to COVID when actually something else is going on. It's another reason that your doctor needs to be involved in your care and involved in this process, also to help guide you along. The last thing I'll say is that one of the best ways to avoid long COVID symptoms is to not get COVID to the best of our ability. Of course, we can do everything in the world right and still get COVID. We know that. But getting vaccinated is one of the most important ways and best ways that we can keep ourselves protected, along with other measures. So get your vaccine if you have not, and make sure that you get boosted and you get everything that you are eligible for right now. Guys, I really hope this is helpful. If you're a COVID long hauler, I'd like to hear. Let me know in the comments. If you are getting treatment from your doctor, you're trying a certain regimen, let us know in the comments what you're doing. You might just help someone else. Guys, I'm Dr. Jen Caudle, practicing family physician, honor health expert, and video creator. For those of you on YouTube, hello, it's good to see you. Please subscribe to my channel, click the little bell for updates. And guys, I hope to see you soon. And I hope this is helpful.